All right, so this video is about how to find out the cause of the back pain due to muscle imbalance. We know that oftentimes people complain about the back pain and they feel they're lopsided, and there's good ways to find out what exactly went wrong. If it's not due to radiculopathy or it's not due to disc herniation, okay? I mean, we all know that there is cross on our upper body and lower body according to Dr. Yanda. The tonic muscle always gets tight, the phasic muscle always gets weak. So in the upper cross, we have the tightness in the upper trapezius, in the pec major, pec minor, so it becomes like this, and the weakness in the mid and lower trapezius. So that's the first cross. And the second cross, we have weakness in the glutes and tightness in the hip flexors. So that's the second cross. That's why we always wanted to work on the glute, work on the abdominal muscle. So that's the weakness, and the tightness is like the spinal muscles and the hip flexors. So that's the lower cross. And those two cross are more in the sagittal plane. So it's like this way, the cross here and the cross right here. But through my practice in many years, over 25 years, I found there's another cross which is more in the frontal plane. And for the lower body, usually if patient says that they have lower back pain on one side, it often means that there's muscle imbalance between one side to the other. And most likely, if it's in the back, the pain is in the back of the lower back, and especially with radiating pain or radiculopathy on the back of the legs, usually the back of the lower extremity is tighter than the other side, which means it can be the hamstring, the piriformis, and also the quadratus lumborum or QL. On the other hand, the front of the opposite side usually gets tight as well. So in the front, usually that's the quadriceps and also the IT band. When we stretch out the tight muscle and strengthen the weak muscle, a lot of times we can rebalance those muscle imbalance, okay? So for example, Nicole has some back pain, right? Is that okay if we kind of like look your back like very like partially? Yeah, okay. So can you stand right here? Okay, I'm gonna have you stand here, and I'm just gonna raise your this way. Okay, so as you can see, it's basically not bad, but there's a little bit asymmetry on the left and right side. You see, it's deeper here, and it's less skin fold right here, right? Okay, so without checking her, I would say the right side is more posterior tilted, and the left is more anterior tilted, because there's less obvious here. So it's more like it's straighter, and this one's more extension. That way you can see more like crease right there, okay? So I am guessing that she has more pain on the right side, okay? Your lower back pain is more on the right side, correct? Okay, and with this information, I expect that she has more tightness on the posterior of the right leg and more tightness on the anterior of the left leg. Make sense? All right, so let me have you go ahead and lie down on your back first, face up, okay? All right, relax there. All right, so let's check the hamstring. Let's review again. The right side is tight in the back. The left is tight in the front. So let's check her straight leg raise. This is the right leg. She's pretty flexible, so it's not gonna be very obvious, okay? This is where I feel the resistance here. The left side, okay, here, it's about 90 degrees. Okay, not much difference. All right, so let's check her gluteus, the piriformis. This one, yeah, okay, here, and then this one, piriformis. So I do feel it's about equal too, okay? So she doesn't have a lot of back pain, so it's not that obvious. Can I have you turn on your stomach, please? Okay, so let's check her quads and IT band. This is the left side. Okay, you can see the hip come up a little bit. This one, okay, not much movement there. This one, no movement. Okay, let's check her IT band. The best way to check the IT band tightness is in this position, the prone position. So here, I can cross her leg this way, and this one, I cannot cross her leg. It's pretty tight. You feel the tightness stretching right here. Okay, so again, this one, I can bring her leg over pretty easily, and this one, it's just like stuck in there. Okay, we can also check her hip flexors. With the knee straight, that's the pure hip flexors, and this one, okay, they're about the same. So hip flexors usually not that much different, okay, unless there's a substantial issue. Then, after we identify there is muscle imbalance and also there is pelvic malalignment, we can go ahead and correct that, okay? So that's basically what we can do in the initial evaluation, and also like reassessment, ongoing assessment as well, to find out if the muscle imbalance is getting less and less, and that means patient should have like more improvement. So if I found there is tightness on the back of the right leg and the front of the left, so there will be posterior rotation of the right pelvis and anterior rotation, relatively speaking, on the left. So I will do the manipulation to bring the pelvis back in like perfect alignment. But after that, I will still want a patient to kind of continue with the stretching exercises for the tight muscle and strengthening exercises for the weak muscle. And that way they can continue to maintain that relationship, the good perfect alignment. Okay, because if you just manipulate and mobilize the joint, yes, after the treatment, it's gonna be aligned, it's gonna be great, even left and right side. But muscle has memories. They become this because of the either habit or prolonged use or like different kind of sports or activities that they've been doing. So the tight muscle gets tight over many years, and the weak muscle, because lack of use, they get weak also over many years. You cannot expect that, oh, after one mobilization, one adjustment, then they're like good from there. They're gonna become tight again, especially if the patient go back to their original activity. So we need to correct those activities, recondition the muscles, and then make sure that the alignment is well maintained.